Catalina, I'm ready if you are. Good. Good morning. The March Louisville Metro Board of Health meeting is called to order. This meeting is being streamed live on Facebook. We welcome to the Community Advisory Board, Dr. Louis Hargett, Vice President of the Greater Louisville Medical Society, who takes Dr. Val's position. And we welcome Dr. Ted Smith, and I always get his title wrong, but I believe he's director or associate director of the Environment Institute and provides us just incredible digital surveillance and panvirome scans of the environment, which is so critical at this moment in time, and a bit more about that. Let me begin with the end in mind. As the country watched with horror and anxiousness the East Palestine, Ohio toxic train derailment, and are beginning to learn about its potential lifetime public and environmental, human, and community impact, we too should contemplate deep diving into our own community's preparedness for a similar occurrence. We know the impact of now emitting plants in southern Jefferson County and elsewhere that are in compliance. What are we doing, however, to ensure that all federal, state, and local laws and regulations are being complied with in full and enforced, and that companies and government agencies are being held to the highest standards? With a point of personal privilege, I say this, having spent my career in regulatory compliance standards for government healthcare contractor. Enforcement and monitoring by government agencies is critical. This issue is not new. We should be effectively monitoring for the communities impacted by the air, water, and soil in these areas. If the answer is everything is in compliance, are there additional public sector changes that need to be made? With Dr. Ted Smith's advice and counsel, we are working to highlight this topic at our April 12 meeting. And let me stop there and remind you that due to Jefferson County's spring break, our meeting has moved to the second Wednesday. Please mark your calendars on that. And I believe, Arlena, you have sent a calendar change on that. That said, in your pre-read materials for the board meeting, there are two action items for our consideration prior to yielding the floor to Mayor Greenberg. Also, an active board member, and a point of personal privilege on that as well, if I might, which is that the first time we have seen, both through the campaign and today, an active board member. And we deeply appreciate that, because it takes leadership from the top in order for there to be system change. First, the minutes from the February meeting were distributed. Is there any discussion? And if not, the chair will entertain a motion to approve the minutes. May I have a motion or questions? Dr. Grisanti, motion. Is there a second?
Second.
Thank you, Dr. Compton. Is there a discussion? Those in favor, please say aye or hands up. Opposed? Abstention? Motion carries, and the February meeting minutes are approved. Second, pursuant to state and local statutes and rules, the board is charged with approving fees charged by the health department for certain services it provides. In compliance with that law, the department has requested some fee changes which were circulated to you in pre-meeting materials. Are there questions? And I believe Dr. Lockett is on the phone here or on video in case there are questions. Hearing none, the chair will entertain a motion to approve the fee changes as submitted by the Public Health Department.
So moved.
Ms. Handmaker moves. Is there a second? Dr. Eccles, did I see your hand?
Second.
Thank you. Any additional discussion? Those in favor? Opposed? Abstention? Motion carries. Now, back to the meaningful part of our meeting. We welcome back Mayor Craig Greenberg, who truly needs no introduction as he has over-earned frequent flyer participation status in our meetings. And we welcome him now as a next generation leader and active board member. We salute his commitment to tangibly addressing the upstream root causes of Louisville's low health outcomes rankings through his initial actions and priorities focused on public health. We offer our hand in partnership as we look forward to those actionable results. We also salute your selection of Nicole George to oversee efforts in part at the department. And I might say, since I'm doing a lot of personal privilege today, that it is my personal privilege to be able to work with Nicole. And she brings to the table something really important, which is representing a part of the community that has been under-resourced and underserved by healthcare in both the private and public sectors. So that will be remedied. I have no questions about that. It's a known. Mayor Greenberg, I yield the floor to Louisville's next generation leader.
Thanks, Heidi, and good morning, everyone. I've got about 20 minutes before I have to run. Nicole and I actually started our day at about 5:45 this morning, and there were some public health enlightenments for us. We worked with a public works crew this morning doing some garbage collection around the city, and it was a very enlightening experience for both of us, riding on the back of a garage of the garbage truck and talking to the employees there and seeing people's habits when it comes to trash. And so there was a lot of that, but my morning has gotten condensed here. But it's great to be with you all. 2 months into the job, I think Deputy Mayor George and I are more optimistic than ever about where we are headed. There's a lot of great stuff happening in our city, all across our city, from an economic and so many other perspectives as well. Yet we're spending most of our time focused on the biggest challenges that we have, things like public safety and improving public safety and reducing the amount of gun violence and violent crime, addressing our homeless crisis and building more affordable housing. I'm trying to figure out how to create more long-term, good-paying jobs for the future economy and helping get more kids from JCPS and really from everywhere into the workforce to get the education and training that they need. And then also to make universal pre-K a reality. These are some of our top priorities of our administration, and they will continue to be the top priorities of our administration. I thought, I know these are maybe what we could do this morning is just pose some questions that we have been thinking about around our administration on that would love, feedback on, whether it's in this meeting or whether it's in just future thought and outreach to either Nicole, myself, or anyone else in our administration. I've certainly had some conversation with certain of you on these various topics, but when it comes to public health, is such a broad topic and it impacts so many people in so many ways. But just some of the things that we would love your thoughts on about ideas for ways that we can continue to address some of the biggest issues to make progress on reducing the amount of gun violence in our community. We're certainly taking a multi-pronged approach. with working with our police department, but also doing everything we can to prevent crime from happening in the first place, to addressing the root causes of crime and poverty, to give kids more hope and opportunity, whether that's through other nonprofit organizations, whether that's through expanding resources and hours at our community centers and our libraries and our parks. There's so much we can and should be doing that we're beginning to do, but certainly welcome impact on that. Along the same lines as that, on a related topic, is it is clear that we need to do more in our community with respect to mental health. And two areas that have popped up very clearly for me are addressing the impact of trauma on victims of crime and their families, and also just generally mental health resources in general for young adults, but also for our entire population, and what can and should we be doing more in that regards. When it comes to homelessness, we have launched a new initiative where we are developing a community care campus in partnership with Norton Healthcare, U of L Health, the Coalition for the Homeless, and I hope many other groups, to address not every cause of homelessness, not every person who is homeless, but to start providing more shelter and services that currently exist in our city for those who are. And we're also looking to address the health and safety of those who are living in camps and those who are not living in camps but are impacted by camps that are around our city. And so that's an area that Deputy Mayor George and I are working on a daily basis. In terms of hold on, I just lost my list here for a second. The climate change and what's going on with our air. You mentioned it earlier, Heidi, in your opening remarks. Air, water, and soil. The folks, Ted and the folks at the Environment Institute, are doing amazing work there. What can and should we continue to do with respect to all of our waterways, from Beargrass Creek to the Ohio River, to our air with our air pollution control district? What else can and should we be doing? When we think about the growth of our community, when we think about some of our own public utilities like MSD, and then also existing businesses that are here, what can and should we be doing more? How do we get the message out about important public health issues, whether it's vaccination issues for our kids, not just COVID, but others? It's my understanding that the JCPS has 10,000 students who haven't had their MMR shots. Like Nicole and I saw today, how do we educate people to use garbage bags when they put their garbage in their trash so that their alleyways don't get even dirtier and start attracting things that rodents and things like that we saw this morning? There are some simple things that people can do to improve public health. And so how do we educate people about that as well? What do we do the future in our corrections? People have read a lot about challenges that we've had in our corrections department. The WellPath contract, which is the contract for health services in our jail, is up later this year. What does the future of providing health care to those who are incarcerated look like, both those who are currently incarcerated and those that are getting out of prison, and how do we help them with a pathway to maintain continued quality health for themselves? What is the future of our public health building over on Gray Street? That is not in the greatest of quality right now. And so as we start to think about the future of our public health department, what does that, where should it be? What should that look like? What should be in there? And also, how do we fill the more than 100 vacancies we currently have in our public health department? Particularly, one of the eye-opening things, which I know was not unique to our department, was with respect to nurses and the challenges we have to fill nurses. Right now, our pay scale is totally out of whack, and so we're totally reliant on third parties and staffing agencies. But in addition to changing our pay scale, what can we do to have some more nurses who are our own employees and not have to rely on third parties for that? Again, I know that's an industry-wide challenge, but we can't use that as an excuse. How do we do better working with our friends in Frankfurt? in the General Assembly when it comes to public health legislation. This session is almost over, but what about the future? So I know each one of those are conversations that can last an entire day. They are not easy answers, but those are some of the things that we are working on in our administration every day that we certainly value continued input on. And if there are other questions we should be asking, if there are other challenges that are out there, we want to know, because we want to be a solution-oriented administration that is really focused on solutions, really focused on taking actions. And if some of the things that we're doing prove that they're not working well, then, that's okay. At least we've tried. We're going to learn from what we've tried. We'll pivot and we'll try something new. So that's a lot of what we're working on. I thank everyone that's participating and working on improving public health throughout our entire city, broadly defined. And I hope that's helpful to tee up some of those questions for you all to think about, not just today, but in the coming days and weeks ahead, that you can continue to share feedback with us on. So thank you
Mayor Greenberg, thank you. That was certainly chock full with action items, and we're here to offer both private and academic sector help, and also social service. A couple of things to you. The first being that Tony Zippel has significant, Dr. Tony Zippel, who couldn't be on this call today due to some travel and commitments that he had, expert in mental health and resilience. And so I would encourage folks to include him in the discussion. Deputy Mayor George and I are meeting on via Zoom or WebEx. March 8, Deputy Mayor, I believe, to talk about, and Eva to talk about mental health in schools. Very, very concerned about that. And it's been good to get nurses into the school system. It seems that one takeaway from COVID has been that the public school system has been a good site for bringing families together and getting the message out and creating vaccination clinics, and great learning there, and their influence is large. Also, I spent some time with President Schatzel at U of L. She brings a plethora of experience from both the tech arena, innovation, et cetera. A great addition and a great partner in this effort. So one last piece has to do with East Palestine. As I sit in a disaster recovery area and feeling firsthand what that's like. There, but for the grace of God go we. And we've had experiences in Southern Jefferson County. We have had, and I'm going to mess her name up, but I believe it's Allison Smith from the Air Pollution Control Board, but whoever the director is there, and the brownfields and the soil impact of the industry in Southern Jefferson County in those areas clearly impacts major health issues, especially as they relate to cardiovascular issues, et cetera. So there's a lot on the table, but I think it's a warning to us to be prepared. And as the chair mentioned earlier, my experience in regulatory compliance is people will tell you that they are compliant, and until they are reviewed by the source of enforcement, I don't, it's trust and verify. And so I just think it was a warning to us. I know that Dr. Smith and I have had a discussion at our April 12 meeting. We will welcome, and I'm going to mess his name up, Sanjay Sriva. I'm sorry, say it again, please.
Sanjay Sriva. He's the director,
professor of medicine, distinguished University Scholar and the Director of U of L Superfund Research Center, which Dr. Smith, I believe, is the only one in the country.
Focused on volatile organic compounds. Yes, that's true.
So that stay tuned for April 11th and any missives that we send out in the interim. Are there questions for the mayor? Guys?
That's right.
Dean?
Yeah, I'll jump in. Just one of the comments you made a moment ago referenced the building on Gray Street. As you know, we're right across the street.
Yep.
New president Schatzel is supportive of a plan that had been evolving here at the university before her arrival. That is to make a capital request of the legislature during this session that would include putting a new building on Preston Street between Gray and Chestnut, where the MedDent housing building is coming down next week, I think. And there's been, some conversation about wouldn't it be interesting to look at the possibility of having both academic and applied public health in the same structure. I don't know if that conversation has floated around too much. I know it has been discussed a little bit internally here at the university. That might be something to kick around.
Great idea. Well, definitely would love to learn more. That sounds interesting. Thank you.
Yes, and of course, there's the partnership with Norton, U of L Health, et cetera, in terms of creating that LUMED in the district. I'm making the number up, but 22 blocks area in downtown. But the building is not the expression of public health that we want the public to know, and as representing public health, and has in the chair's opinion has serious environmental issues associated with it. So anyway, for what it's worth, is there a question? Anybody? Well, again, I commend the article or recommend. Oh, Dr. Hargett? Dr. Hargett? I see your hand up.
Yes, I was on mute. I'm sorry. I just wanted to ask, how close are we to getting a new police chief?
We have, we did an RFP for a search firm. We have finished the scoring process and are in the process of finalizing the contract with that search firm. I'm hopeful that they start their work in the next couple of weeks. And so I don't know how long it takes once they start their work. That's what we're going to be discussing, but it's probably, 2 to 4 months from now will be the process, is my guess. And I'll announce when I know what the exact timing is, we'll announce it, but we should have the search firm beginning their work in about 2 weeks.
Thank you for
Dr.
that.
Hargett,
I think it's important that we have that leadership in place, given the balance that we've had here in Louisville. So thank you for that.
No, I appreciate it. And we're not, interim chief Jackie Gwynn Biller-Roel is fully empowered, and I think is doing a lot of good work right now. And I'm really pleased with what we're working on in partnership with LMPD and other agencies right now.
Okay.
All right. Well, thank you. I think Nicole's going to stay on for a little bit longer, but thank you guys. I'm sorry I've got to run, but good to see you all this morning. Thanks for all your work.
We deeply appreciate it.
Take care.
We'll be in touch. Thank you. And thank you, Nicole. Nicole, while you're on, is there anything from your role that you wanted folks to know before you depart?
No, and I'm planning to stay on for the course of the meeting. I would just echo all that the mayor said and want to thank you guys because 2 months on the job, I would say I am the better for our partnership and for the connections that folks as part of the board have helped inspire. And continue to welcome feedback in the learning process as we proceed.
Great. Dr. Eccles?
I think I have more of maybe a general comment than a question per se. But I would just like to say, that I think that this board does a really good job of highlighting all of the different resources that we have for ourselves in the Louisville metro area. And when we speak to things like, things that may not on the surface seem like public health issues, such as maybe gun violence or potential, childcare, a lot of the different things we've talked about, the tree canopy. I think that we are able to, provide insights or opinions or connections that our chair is so very good at readily pulling on and calling forward in the community. And I just really look forward to, being a member of this board and recognizing all of the things that I'm hoping and the changes that we'll be able to kind of help push in the coming months and years with the new administration. So thank you for being here, and thank you to all of my fellow board members, because I really do think that we have a lot of potential to have really positive impacts on our city.
Let me say, and let me echo what you're saying, Dr. Eccles, in terms of my deep appreciation to each one of you for your active engagement. We talked about that at the very beginning years ago, and you have lived up to that. Deputy Mayor George is very open. The competency, I believe, that she has, spoken from a large private sector standpoint, is that she is a positive system disruptor who can deliver on execution and believes in metrics and please forgive me, corporate words, has a net. And she and I talk very early in the morning and follow up. And this relationship with the mayor's office, I think, is someday will be nationally acclaimed for its partnerships. And I think that Nicole's bringing of her experience in the southern part of our county, and Craig's, Mayor Greenberg's experience in the private sector and in innovation and in tech startups, et cetera, is a perfect blend for us to do things that we become known for. This city has a lot of private sector healthcare innovators, large companies and smaller companies recognized nationally that call Louisville home to their headquarters. And we need to build on that, and by building a strong public health arm to it. And so thank you to everyone. And Dr. Eccles, thank you for your participation, and your questions, board members, are critical with our prospective session speakers to get at the essence of change, positive change in the system, which we know our city needs. So enough filibustering on the part of the chair. And, other comments from board members? Okay. Now, on to other business issues. And I give this one with a warning that what the chair is about to say comes from personal distaste for unnecessary bureaucratic processes that create busy work. But with the patience and the understanding of our council, Natalie Johnson, we need to take an additional action to close on the properties we already transferred to Metro government. Portland Property for Family Health Centers, which is now owned by FHC, and the department's building and lab, as well as the undeveloped piece of land in South Jefferson County, which was also transferred to Metro government. The resolutions, which would be the deed transfers, were in your board materials. The chair will entertain any questions, and if none, would entertain a motion to approve both the deed transfers. And with a thought that we all pray this concludes the arduous for all transfer process. Poor Natalie. And with sincere thanks to her for bearing the chair's distaste for this kind of paper extravaganza. So anyway, are there any questions? And if not, the chair will entertain a motion.
I can support that. I have a long history with the need for this, so I move that we take the action.
Thank you, Ms. Handmaker, and also for your public service, and also for being a lot more patient than the chair in this process. Is there a second? Thank you, Dean Compton. Any other questions or discussion? Hearing none. Those in favor, aye. Those opposed? Abstentions? Motion carries and the deed transfer process is approved. The chair, let's see, we've recognized Deputy Mayor George. Anything else? Okay, now the chair recognizes Director Howard, and he's been involved over the last several days in what I would term communicable disease handling. How's that?
Madam Chair, that is an adequate description, as always. In our line of work, communicable disease handling, so to speak, never seems to end, and is a part of the job. And I will tell you that we, from our mayor's office, had a lot of support this weekend for it. And Nicole and I were on the phone this weekend discussing some issues that popped up. I do have a couple updates for the board that I would like to share. First, to address the possible or the communicable disease topic referenced by the chair. So briefly over the weekend, through our partnership with the Environmental Institute and our wastewater testing, we had noticed there was a spike of measles in our wastewater, which was concerning given the recent measles outbreak with a few cases in Kentucky, and then there having been a case that has been associated with the Asbury Revival Services. In further investigation, we discovered that there was also mumps and rubella, and this seems to correspond to the vaccine and the same geographic areas where vaccine production or vaccines events had been held in Jefferson County recently. The current testing by Ted Smith's Environmental group was not able to differentiate the vaccination virus compared to live virus or wild type virus. However, PCR testing will give us that information hopefully by the end of this week or into early next week. But based off the totality of evidence, we're fairly confident that this was just related to vaccine events, especially having mumps and rubella in the same wastewater samples. But I think this, more than anything, highlights the agility that having this very strong partnership with the Environmental Institute provides our department and our community in this administration. It's my hope that over time we continue to strengthen this relationship, continue to invest in it from a capital perspective in order to continue to be proactive and grow our ability to be proactive in disease responses. As we certainly seen with COVID-19, we were mostly caught and reactive. And the vision, at least I have, and I'm sure I share with Mayor Greenberg and Nicole George, and I know I share with the board chair, is to have a department that is proactive in nature. So this was honestly, although it was a little nerve-wracking, wondering if we might have some measles cases pop up in the Jefferson County area. it was exciting to know that the work that we've been investing in can show us information in real time, even before cases begin to present. So very exciting. Again, I do not think, based off the available information, there's anything to be concerned about at this juncture. But again, was just something worth noting to the board and highlighting a very important partnership that we have ongoing. A few quick updates from the department as a whole. We have been working to strengthen our harm reduction partnerships, and we have facilitated Narcan training through the Louisville Free Public Libraries in our partnership with the Healing Communities Study. We're very excited with that, but 75 of their employees have signed up for Narcan training so far. So we believe this is a great opportunity for community outreach for our department and continue to address the scourge of substance abuse and deaths thereof in our community. There's several, I won't go over all these, but there's several policy briefs that have come out from our department recently on important policies. Those have been provided to you in our briefing document that are just public health policies that we support in our community. And then finally, we have, in addition to the senior directors team, which previously was Connie Mendel, Stacy Ingram, Taylor Ingram, T. Gonzalez, and myself. And that addition is Kelly Alexander. Kelly Alexander was former chief of staff of the Kentucky Department of Public Health. She joined our department mid-July and was asked to join our senior directors team as a senior leader in our department. She obviously, having been the chief of staff at the state level, has a plethora of experience that she brings to our department. Additionally, she's an attorney, is a member of the Kentucky State Bar, and we really are excited to have her with me. And I've been with her through most of her public health career. She came, I actually met her in 2000, I believe it was 2017, when she was an estate planning attorney and real estate attorney. Had a strong interest in healthcare and wanted to transition careers, and she joined the Department of Public Health at that time as our communications director. Was swiftly promoted as chief of staff, where she did an outstanding job for not only myself when I was state commissioner, but a second commissioner and then a third commissioner in Dr. Steve Stack, and then transitioned to work for us here in our hometown of Louisville. So we're very happy to have her. Final update I would like to give the board is regarding the state of the physical department. As of today, we do not have an estimate when we will be fully back in the department. Our goal is always to have clinically functional and units, and we continue to meet the needs of our community and continue to offer the clinical services we had before without disruption. But in terms of, we do not have a date in terms of when we will be able to bring everyone back to the office at this standpoint. The statement we continue to give is we hope to be back sometime in 2023. Obviously, we hope it is sooner rather than later, but we're still working on estimates and figuring out timelines for repairs to the department. I think that's it for me, Madam Chair.
Okay, this probably, Dr. Howard, goes to you and to Dr. Smith. It occurs to me that the city is a member, and Deputy Mayor, most especially Nicole, the Big Cities Health Coalition is a critical entity in that it has, and I'm going to get the number wrong, 10 or so. And for those of you on the board, we did have the executive director speak to us about a year ago, I guess. But the work that Dr. Smith and colleagues at the Environment Institute and the Pan-Viron panel and how we're doing surveillance, digital surveillance, is nation leading, and will, I think, do a lot to promote the city with regard to public health. And so Deputy Mayor George and my call coming up will probably address that as well, so that we're sure that we're maximizing the work that we've done, because the huge takeaway from COVID was we were reactive and not proactive. And with the Pan-Viron work, we're able to predict early and take those preparedness actions, very similar to when we call in the MSD and the water company and those people to see what we can do on in their area to prevent an East Palestine, Ohio. So preparedness, redundancy, we've talked about that a lot. Any questions? Okay.
I just want to chime in if I can to thank Dr. Howard and Deputy Mayor George. The sequence of communications over the weekend was intense, and just everybody dropped everything, and it was sort of Louisville at its best as far as I'm concerned. And I really appreciate our ability to swiftly act and work through the data. We continue this project that Dr. Howard mentioned with the state's involvement. And we actually have samples coming from Lexington because of revival that was held on Sunday at Rupp Arena. So we're continuing to try to figure out how to figure it out. But I'm really grateful to have such strong partners in Metro government and in the community. So just a word of thanks. Thank you.
Thank you, Dr. Smith. And it brings to mind something else that we have probably over communicated with each other, and that is to your networks. These groups that come together with no protection can have the opportunity to present a public health problem for the community, and that would be unknowingly. But we desperately need to get the word out and maybe work, Deputy Mayor George, with the Convention Bureau or whoever is responsible for scheduling these meetings to cite the availability of having someone on site to provide that. And I will certainly, I think we can get Norton, U of L help, we can get folks together to provide the coverage for that, because I recognize the department can't do that themselves. But we really do need that because it infects our community and it infects the state. And I was rather traumatized by the Asbury College piece. So anyway, any other comments? Thank you for that. Okay.
I have a
All
question.
right. Yes, ma'am.
Hi, Dr. Howard. If, hi, long time no see. If it had been a real outbreak of measles or an indication of that, what actions would be taken?
That's a great question. I mean, the first thing would be to analyze the data on what we would know at the time. We'd immediately go into, we would immediately circle up the wagon, so to speak, of our team of epidemiologists, clinical practitioners, et cetera. And if it's one patient, if it's two patients, all the response would depend on sort of the data available. But what we would immediately go into is a sequence of events to try to isolate those who have been exposed, to prevent ongoing spread, and then immediately move into contact tracing, and then finally go into a vaccination mode where we're quickly distributing vaccines to those who may be at risk for exposure in those given communities. That would be the sort of generic order of events, and the magnitude thereof and the intensity of a response would depend on what we deem the threat to be. For example, should there be a mass gathering, an Asbury type gathering, in our community, and we knew there was confirmed measles, obviously that would be a very intense response, in which the contact tracing burden would be enormous. We would be going to this board, to Deputy Mayor George and Mayor Greenberg, probably seeking funding or the ability to utilize existing funding and perhaps ways that are allowable under certain types of public health urgencies or emergencies, in order to be able to fund a response quickly. Our biggest challenge, and I do want to be transparent, our biggest challenge in a situation of that type currently will be staffing response. And so we would be looking to procure staffing either through agencies very quickly. We've done that in the past with partners like Lacuna, for example, that we may have to look to again in that situation.
Let's set that in advance. And Dr. Howard, I'm happy to help where I can on that. But that Lacuna came to my mind too. And the call centers and getting that up. And I don't know who, I think the department, I'm looking for Connie or Dr. Locketts or somebody, to see if, I think we still have Lacuna.
We do.
Okay.
It's just
Um,
scaled down. I will,
And then the other piece is I didn't, and it's hard for me to see on my screen whether we've got JCPS on, but the fact that they have nurses in schools and perhaps, and I believe we're partnering. I could be making this up, in those areas of the county that where the vaccination rate across the board is extremely low, but this would be, in the cellar, so to speak, with regard to vax rates. So let me know how I can help on that. And, but that collaboration, I think, will be important.
I mean,
Other
again, I just can't
comments?
reiterate enough. Our biggest challenge in that situation would be staffing, and there'd be a whole chain of sort of a regular public health response action that would just immediately sort of take place. But that
Well,
would
let's
be
also pair with Dr. Schatzel. She's going to understand this.
Gotcha.
So let's collaborate there, and I'm happy to affect that, and as well through Mary Nixon and Board of Trustees.
Yes, ma'am.
Dr. Smith, did you have something? I saw your head pop up.
No, I was just doing that to scare people. I don't have anything else. Thanks.
Okay, done. All right. Any other comments here? All righty. Community Advisory Board updates only of issues that the board needs to be aware of. Is there someone from JCPS on? Dr. Irwin, FHC?
Yeah, so I'm happy to announce that after a long wait, our mobile medical unit, 26-foot van, has arrived last Friday, and this van will be used to reach out to homeless persons and provide medical treatment, those who are living in camps and on the streets. And we hope to get that operationalized within the next month or so.
Would you send a picture and we'll share with the board and what it looks like, and if you get some clinics set up, some photos of that as well, so we can publicize that?
Yep, be happy to do that.
Great, and we commend you for that, and the community will be healthier as a result. As I mentioned, the Greater Louisville Medical Society, we have a new rep. Very pleased to welcome Dr. Lewis Hargett. Dr. Hargett, do you have any update you wish to offer from GLMS?
Yes. First of all, I want to just say thank you, and I look forward to serving on the board and representing GLMS. What I want to say is that February the 22nd, we had the KMA, Kentucky Medical Association, had their annual Physicians Day at the Capitol. Just to let you know that the Greater Louisville Medical Society was well represented. We also had students from the University of Louisville that also participated with it. Obviously, we had physicians from across the state as well as students from UK that participated. It was started off by our KMA president, Dr. Mona Lisa Taylor, at the rotunda of the Capitol with the introduction, and then we paired off and we went out and we met some of our representatives from around the state. A physician's wife, Ms. Kim Moser, her husband is a past KMA president. She's also a representative, and she was one of the sponsors for one of the bills that we were very interested in, and that's House Bill 154, which is concerning prior authorization exemption. All of us know about that and the challenges that we as physicians face with that for the care of our patients. We also met and discussed topics that are important to physicians, such as physician wellness. And so we had good meetings with our representatives. Following the meetings at the Capitol, we went to the Capitol Plaza Hotel as the KMA group to discuss what we'd accomplished during our visits for the day. and to have a KMA meeting. So we just had a very good meeting. We discussed topics that we felt as physicians were important to both physicians as well as for our patients around the Commonwealth of Kentucky. And again, the GLMS was well represented at the Capitol. Thank you.
Are there questions for Dr. Hargett? Thank you, sir. Look forward to your active participation, and again, welcome. Okay, is there a rep from the Kentucky Nurses Association? I believe that Delanor, Ms. Manson, had a conflict this morning. Ms. Somerville from GLI? Are you on? I can't tell. Okay, moving along to key committee updates. Dr. Eccles from the Immunization Committee. Or Dr. Patricia Bautista Cervera, updates?
Yes, if I may, even though JCPS is not present today, they shared at our immunizations committee that they had a successful vaccination clinic, February 4th, 300 people, 300 vaccines, 250 people participating. Other organizations like La Casita Center had another immunization vaccine clinic. It was 60 vaccines, 45 people participating. There is a new vaccination clinic on JCPS coming March 11th at Iroquois High School, where MMR will be offered along with COVID and flu vaccine. The same with La Casita Center, another immunization clinic with flu vaccine and COVID vaccine as well. That's it.
Fabulous. That was a clinical term. But we applaud those efforts, and especially in our immigrant community. Very important. Mayor George?
Thank you. I just have a quick question about what we're learning in the way of trends related with for the folks who are getting vaccines in schools. You know, what are we hearing is really inspiring that decision? And then my second question, I mean, I just want to say, first of all, thank you for your commitment to Iroquois High School and being in the vicinity. And how can the community support that and better get that information out and or encourage the school to do that?
This is an effort from JCPS. We are, as other organizations, will be partnering with JCPS to promote and do the social media campaign and the distribution of the information. I think JCPS is partnering with Norton and other organizations to accomplish this. I'm not really sure about who are the other partners. We'll have a meeting, or I'll be participating in a meeting with them pretty soon, and I'll let you know. I'll ask Eva Stone or Angela Hayes to keep you up to date and let you know what's going on.
That's perfect, because Deputy Mayor George is the perfect connection for that area of town and should be a part of the process. Thanks, guys. Look forward to the report out on, as I think you both know, as the metrics for how we did. And because we do, this board, based on your participation, has the ability to change our low health outcomes rankings and do it in terms of health policy. So let's see, Ms. Shoemaker, Medicaid. Big news there.
Yeah, so we met on February 13th and discussed the plan to get the word out that Medicaid renewals are coming. Discussed efforts for connectors, doing outreach events. There will be a text message and email campaign from the state as well as a social media campaign. The MCOs will also be reaching out to members and by calling and texting and emailing. But the Medicaid renewals will start again on April 1st, with the first deadline of May 31st to submit their renewal. And this will be a 12-month process. We estimate that I believe around 45,000 residents of Jefferson County are at risk of losing coverage. They will need to take action to complete their renewal. Try to spread the word to make sure that you update your contact information, check your mail, and once you do receive that renewal packet in the mail, take action as soon as you can so you can keep your coverage. And our next meeting is scheduled for April 10th at 4 o'clock.
Thank you for all your work, and it's an impressive coalition. There are about 25 people generally on the call. I try to make at least half the call. Salute you for your leadership in this arena, because there are tens of thousands of people who are affected by the end of the public health issue and with COVID, and so public health emergency. So thank you very much. And so, anything else from the board? So, repeating, next meeting, April 12th, how Louisville will be prepared for, the news of late has been negative, and I am an eternal optimist, positive system disruptor, and I know many on this call are, but how Louisville will be prepared for oncoming planes, trains, automobiles, and perhaps with a little humor, UFOs and balloons. I do, Dr. Smith, want to again say that Deputy Mayor George, let's talk about getting some of our work on digital surveillance to big cities so that we get some positive national acclaim rather than a lot of what we've had. And if there's no additional discussion or objections, the meeting will stand adjourned. Any comments? Or this might be the speediest one we've done. All right. Any objections? Hearing none, the meeting stands adjourned. I want you to stay well, be well, get kids vaccinated, and remember April 12th. Thanks so much.
Thank you.
Keep the cards and letters coming. You all are the best.
Take care.
Bye.